Hi, I'm Dr. Olivia Novak. I'm an optometrist here at Virginia Eye Institute's Puddle Dock location in Prince George. So when I was in undergrad, I originally went to UNC down in North Carolina, go Tar Heels, and I always knew I wanted to be in healthcare, but maybe not where I wanted to be necessarily, but I always knew I loved my optometrist, and she always took really good care of me. And so just throughout undergrad, I did a couple classes and physics, and I did a few other shadowing opportunities and volunteer opportunities down at UNC and all these things slowly built, and little by little I decided, okay, yeah, I like eyeballs, I like caring for people's vision, I like helping people see, and I really liked the profession. I loved every optometrist I met, I loved every ophthalmologist I met, and I just thought the world of vision care was really good and really important for everyone. So I eventually applied and I loved it, and now I'm here at VEI. So I toured out a lot of different places and interviewed at a lot of different locations. I loved Virginia Eye Institute, one, because we are such a large practice. There is tons of doctors at this location, tons of really qualified doctors, tons of people who are at the top of their field, top of their game, and I really wanted the opportunity to work alongside both my fellow optometrists as well as my fellow ophthalmologists who went through all the rigorous training through medical school and their fellowships, who are specialized in glaucoma and retina and surgeries, things that I as an optometrist don't have access to. I wanted to be a part of that scene as well and kind of work at the forefront of my education and my scope of practice, but also be able to assist in their cases as well. As an optometrist, I mostly do comprehensive exams, so we do your glasses, your contacts, your standard yearly exams. For me specifically, I also like to do dry eye management. I do a lot of soft contact lens fittings, and I'll do mild to moderate glaucoma and diabetes exams. So I'm not originally from Richmond, so a lot of my fun that I like to do is going and exploring new places, big foodie. If you as a patient have a recommendation for me in the room, please tell me. I'm always looking for new restaurants, new places to go. In my personal hobbies, I also love to oil paint. I mostly do lots of landscapes work, and that was always something fun to do when school got a little tough, to just kind of go back and just pick an artistic hobby, use that other side of my brain. I'm also a big hiker, love to be in Virginia for that reason. We're so close to the mountains. I've also done some other cool adventures. I've actually hiked across Spain before as part of my undergraduate. I did a study abroad where we did 500 miles across Spain. So big into hiking. I know a lot of people say they like hiking, but I very much like hiking and like to do all that. For me, the most important thing in the exam room is always my patients, of course. I love interacting with my patients. That's a lot of the reason I love my job so much. So for me, I always make sure that we talk about your needs and concerns first. A lot of the time, the patient knows their body really well and understands when something goes wrong. So I want to make sure we get a full understanding of what you believe to be the issue and what you think I might be able to do to help. A lot of the times it's just, a little tweak of the glasses, a little tweak of the contacts, but there can be other issues that are underlying. So we'll get a full case history, see how your systemic health is affecting your eye health as well. Because sometimes you can have heart conditions, vascular issues that also affect the eyes, and you might not even know you have them until I take a look.